your phone in the...
Okay.
I might have to go to the gym.
Okay. Oh.
Breast cancer is the leading cause of cancer-related deaths worldwide for women with increasing trend in recent years. My mom has breast cancer, so learning about breast cancer is really important to me. Most people know or know of someone with breast cancer, so today you'll learn what breast cancer is, the symptoms of it, and the treatments that go along with it. First, I will be telling you what breast cancer is. Breast cancer is a malignant tumor that starts in the cells of the breast. There are 14 different types of breast cancer. They are ductal carcinoma in situ, DCIS, invasive ductal carcinoma, IDC, IDC tubular carcinoma of the breast, IDC medullary carcinoma of the breast, IDC mucilus carcinoma of the breast, IDC papillary carcinoma of the breast, IDC cribriform carcinoma of the breast, invasive lobular carcinoma, inflammatory breast cancer, lobular carcinoma in situ, male breast cancer, Paget's disease of the nipple, phyllodes tumors of the breast, and recurrent and metastatic breast cancer. The most common type of non-invasive breast cancer is DCIS. DCIS is when the cancer starts inside the milk ducts and doesn't spread beyond them. DCIS is not life-threatening. When you've had DCIS, you're at a higher risk for the cancer coming back. The chances are under 30%. The most common type of invasive breast cancer is IDC. Invasive ductal carcinoma refers to cancer that has broken through the walls of the milk duct and begun to invade the tissues of the breast. Over time, IDC can spread to the lymph nodes. Invasive means that the cancer has invaded or spread to the surrounding breast tissues. About 80% of all breast cancers are IDC. Now that you've learned what breast cancer is and the different types of it, you'll now learn about the symptoms. There are two different types of symptoms, physical and non-physical. There are physical symptoms of breast cancer to look for. Physical symptoms include swelling of all or part of the breast, skin irritation, breast pain, nipple pain, redness or thickening of the nipple or breast skin, nipple discharge other than breast milk, and lumps in the underarm area. According to Symptoms Cluster and Quality of Life prior to surgery for breast cancer, a study was done to examine the pre-treatment symptoms clusters that women awaiting breast cancer surgery are experiencing and the impact of these symptoms on their quality of life. Participants in the study experienced pain as being a more prevalent symptom, 35% of the women said. There are also non-physical symptoms. The participants in the same study, as I previously stated, experienced fatigue at 32%, sleep disturbances at 25.5%, and depression at 11%. You've just learned the symptoms of breast cancer. Now we'll move on to the treatments. There are 4 different types of treatments, which are surgery, chemotherapy, radiation therapy, and hormonal therapy. Surgery is usually the first option and is very important for the treatment of early-stage breast cancer. There are 6 different kinds of surgeries. A mastectomy is the removal of the breast. Lumpectomy is the removal of only the tissue in the breast. Lymph node removal is the removal of lymph nodes. Breast reconstruction is the reconstruction of the breast after removal of the tumor. Prophylactic mastectomy is a preventative removal of the breast, and prophylactic ovary removal is a preventative surgery that lowers estrogen in the body. The next treatment is chemotherapy. Chemotherapy treatment uses medicine to weaken and destroy cancer cells in the body. This is a systematic therapy, which means it affects the whole body by going through the bloodstream. It's proven that the efficiency of chemotherapy decreases with age, from a 27% proportional reduction in the 10-year mortality for women less than 50 years of age, to 14% for women aged 50 to 59 years, and 8% for women aged 60 to 69 years, and no benefit for women 70 years or older. My mom has undergone chemotherapy twice, and she describes it as, the first time I did chemotherapy in 2002, it was exhausting and I got sick a lot. But now, 14 years later, since they've improved the chemo so much, I don't really have any side effects. I look at chemo as medicine that's trying to help me, instead of the popular belief that you're just pumping poison in your body. I think that losing your hair is the hardest part because people know that you're doing chemo and they just look at you different. The third type of treatment is radiation therapy. There are 3 different types of radiation: external, internal, and intraoperative. External radiation is the most common type of radiation, and it consists of daily outpatient treatments for several weeks. According to variation in the cost of radiation therapy among Medicare patients with cancer, the median cost of one course of radiation therapy for breast cancer patients is between $7,300 to $10,300. The last and fourth type of treatment is hormonal therapy. Hormonal therapy medicine treats hormone receptor positive breast cancer in 2 ways. The first way by lowering the amount of the hormone estrogen in the body, the second way by blocking the action of estrogen on breast cancer cells. There are 3 types of hormonal therapy. 3 types are aromatase inhibitors, selective estrogen receptor, and estrogen receptor downregulators. Most people know or know of someone with breast cancer, so today you'll learn what breast cancer is, the symptoms of it, and the treatments that go along with it. No one plans for breast cancer, but now that you know, you'll be prepared. You can use everything you learned today in case breast cancer creeps into your life.